We also allow manufacturing and distribution operations to open with a maximum of 5 employees in a space large enough to keep these workers at least 6 feet apart at all times. For those businesses already open using curbside pickup or delivery, they must continue to operate with a minimum number of employees possible. This latest order will also allow an outdoor retail facility such as a garden center or greenhouse to allow in-person buying in these outdoor spaces, but no more than 10 people, including customers and staff, will be permitted at any one time. And as I said last week, the Agency of Agriculture has been working on a plan to allow for the reopening of farmers markets on May 1st. But let me be clear, this will not be a traditional farmers market. I've asked that guidance focus on food distribution, not a social gathering. Again, the best way to continue to make take small steps forward is to make sure we put health and safety first. All of us, employers, employees, customers, must take this responsibility seriously. This is literally in our hands, and we have to do this right because we don't want to lose ground or change the trajectory we're on. If we want to continue getting Vermonters back to work, there must be a constant, consistent, everyday battle to fight this virus. Again, I know some will think this is too much, and there are others who will think this is not enough. But I continue to make this pledge to Vermonters. We will take a careful and measured approach, with health as the #1 priority. No one wants to get Vermont back to work more than me. But as we do, we must outsmart and beat this virus. I know together we can build on our progress, stay united in this work, and get through this stronger than before. And as we think about our economic challenges about this recovery, I'm pleased to have Congressman Welch here with us on the phone to give us an update on what's happening in Washington. Congressman Welch, are you on the phone?
I am.
Great, thanks for joining us.
Governor, well, I'm delighted to be with you. I first of all want to say that the most important focus that you have is the right focus to have, is the most important one, and that's the health and safety of Vermonters. And the more Vermonters are paying attention to the steps we have to take to keep ourselves and the people we love healthy and safe, that's going to have a ripple effect beyond Vermont, because we all have to be in this together. And the states, through our governors, have to take the responsibility and the lead on the measures that are required for Vermonters and all of us to be safe. and that's a big responsibility, and you and your team are really facing this very directly. And as one Vermont citizen, I want to say thank you for that. The federal role is really important as well, and that is to try to get us through what is an economic crisis. The effect of social distancing is to shut down business for quite some time, and we know we have to do it, but it's not without consequence. So I'm very pleased in Washington that there's been strong bipartisan support for economic measures. And I'll just go through those very quickly, but that is the $1,200 checks that are going out. They were a little slow coming, but they seem to be underway. Anybody has problems with that, then contact us and we'll try to check into it. The unemployment insurance supplement is helping. And of course, the payroll protection plan and the economic injury disaster loans. The payroll protection plan fund ran out. And yesterday, we were in the House of Representatives and passed additional funds for that program. It's been very popular in Vermont. We've had about 7,000 businesses successfully get authorized and have funds available of about $1 billion. And that is, I think you pointed out, puts Vermont as the third highest per capita in the utilization of that program. Yet many Vermont businesses didn't quite make it before funds ran dry. And the legislation that was passed in the Senate a few days ago with the strong support of Senator Sanders and Senator Leahy, we voted on yesterday in the House. And what it does is, number one, adds $370 billion to the payroll protection plan and the economic injury disaster loans. So Vermont businesses that have filed applications, there's now money that's available through the SBA to hopefully have your application be successfully granted. The legislation also puts $60 billion in the economic injury disaster loan and grant program. So I would encourage Vermont businesses to make those applications. The legislation specifically authorizes these programs to be available to Vermont's agricultural community. And we know that Vermont dairy is really on the ropes, and we're hopeful that this additional language, making it very specific that these programs do apply to our dairy farms, that this can be helpful. In addition, there is $100 billion in this package that goes back to for health care. $75 billion to help our hospitals, and that's obviously extremely critical for us in Vermont. We've got a network of hospitals serving rural Vermont, as well as, of course, our UVM Medical Center. And this is going to be very important that Vermont get some help in order to maintain the important work that those hospitals are providing to us now and in the future. And then one additional provision that I think is extremely important and overdue is $25 billion for testing. And Governor, as you said, this first step in this is that we have to have social distancing to flatten the curve, and we're having some success on that effort. But then that doesn't cure the disease. It doesn't eradicate the disease. We have to then do testing. We have to do contact tracing, and then we have to have a capacity to quarantine. And this $25 billion in testing is an acknowledgement of the absolute fundamental importance of testing going forward. So Congress has authorized the funding. We want to get that back to the states to help the states where the big challenges of implementation is going to occur. So this is good news, but I want to also acknowledge that this is incredibly difficult and challenging times for Vermont enterprises. You know, most of our Vermont businesses they're small family affairs. The people who work there are like family, and to suddenly have to, for public health reasons, shut down adds financial anxiety as well as health anxiety. And as much as these programs have been funded, the first package was $2.2 trillion, the second, this one was close to $480 billion. It's probably not enough, and we're going to have to continue our efforts. My hope is that on this too, we'll be working with the SBA to get input from our businesses about where we can make some adjustments in what the regulations are to provide some flexibility to meet the needs of the particular circumstances of our businesses. That's important, that we continue to be as responsive as we can be to the real world situation that our businesses face. I just want to say something about going forward. As you pointed out, Governor, this economic situation has placed immense pressure on state revenues. Vermont's not unique at all. And we must have as a focus going forward in Congress going forward, providing aid to the states. And I think that is an acknowledgement that the revenues have collapsed in states. And if the federal government is really the only governmental entity that has the fiscal capacity to respond to this once in a 100-year event, if we don't, and somewhat generously, then it's going to put enormous pressure on our property taxpayers it's going to put enormous pressure on our state budget. Will we be able to fund education the way our kids need it? Will we be able to provide access to health care the way our citizens need it? And this event was not the result of any actions in any state. It's a result of the public health epidemic. So my hope going forward is that in the next aid package, we do focus on two things. One, among others, but one is aid to the states, and B is flexibility so that the states, when they do get aid, can make some of these tough decisions that are better made in Montpelier and in your office, Governor, rather than in Washington. So it's great to be a partner with Patrick and Bernie and you and your team. This is a situation where Vermonters know from experience that the best approach is all of us in it together, all for one and one for all. And somehow, some way, with persistence and calmness, we'll get through this. Thank you very much.
Yeah, thank you very much, Peter. We appreciate all you've done for our state as well as the rest of the congressional delegation and trying to work together. And we're doing that on the local level as well with our legislative counterparts and just trying to get through this and take the politics out of it. And you've been successful in doing that, and we appreciate that.
Thank you, Governor.
And at this point, I'm going to turn it over to Commissioner Pichek for his presentation on modeling.
Good morning, everyone, and thank you, Governor. My name is Mike Pichek. I serve as the Commissioner of the Vermont Department of Financial Regulation, and I have been leading the state's efforts to model and forecast the trajectory of COVID-19 in our state. Today is our fourth media briefing on the state's efforts to forecast the progression and impact of coronavirus in Vermont. As in previous briefings, I will provide an overview of the developments from the past week and then touch on a look forward. Overall, the news continues to be good. Vermont's actual experience continues to trend better than even our best case forecasts. Last week, we announced we had reached the peak of new confirmed cases. This week, the data indicates that we have likely reached our peak regarding the demand on hospital resources as well. And also, in the near future, we anticipate reaching our peak of Vermonters with the active virus, a very important indicator. I want to start first with an update on our mobility data. Our first slide illustrates the decrease in mobility in Vermont over time. First, for Vermont on the left, and then northern New England on the right. You can clearly see Vermont's high level of compliance, and that also compares favorably to our counterparts in northern New England. Further, and I think most importantly, you can also clearly see Vermonters' continued compliance with social distancing, even as the weeks wear on. This is why we are continuing to see better than expected outcomes. The information is clear, and the conclusions leave no room for doubt. We have also stated all along that practice social distancing is the most important thing Vermonters can do, and it's clear that together our mutual sacrifices are helping us to defeat the virus and continue to save lives. On our next slide, we address the new case growth over time. Vermont continues to see a downward movement in the number of new cases of COVID-19 reported. Over the last week, our 3-day growth rate fell to less than 1%, down from 2% last week and down from 9% the week before. You can see how quickly the virus was growing here in Vermont in mid and late March. And then you can equally see how quickly Vermonters were able to stop the virus in its tracks come late March and middle part of April. At this point, we don't expect our case number in Vermont to double for 37 days. That's an improvement from 27 days last week. Again, I think this clearly shows you how quickly our social distancing efforts were effective, and that is great news for Vermont. Our next slide will show our forecasting for the time period ahead. You can see our number of forecasts that we ran over time, and even the one that we ran this week shows that our actual data continues to beat those trends. Again, this is very good news, and again is clearly connected to the social distancing that Vermonters continue to practice. Our next forecasting continues to give us confidence that we can meet the healthcare resource demands for COVID-19. Our PPE supply, our hospital and ICU and ventilator capacities remain far above the current projected needs. Our next slide shows that the trends indicate we are continuing to see improvement in our actual hospital demand. We see the number of hospitalized patients start to decrease, the number of ICU patients, and the number of ICU and ventilated patients decreasing as well. Again, when we compare this to last week, our numbers have improved, and this is a very good indicator. With all this positive news, I do want to stop and remind everyone that we need to stay vigilant. Although we have seen a reduction in the new number of COVID-19 cases, many people in Vermont are still shedding the virus, meaning that they can infect other people. As we can see on our next slide, we don't anticipate reaching our peak on this important measurement until about a week or so. So again, more good news we anticipate on the way, but only if we continue to make the sacrifices that we have been making for the weeks that lie behind us. Our next slide shows that the percentage of Vermont COVID-19 tests that come back positive over time is also trending in a good direction. This indicator is very good news for Vermont. The experts on our team and also those at the World Health Organization indicate that the confirmed positive cases under 10% indicates a state or a region is on the path to containing the virus. And here in Vermont, we've been consistently under that 10% threshold for over a week. Again, while maintaining consistent testing. All very good indicators. Looking ahead, we mentioned last week that we had partnered with the University of Washington's Institute for Health Metrics and Evaluation, better known as IHME, one of the nation's premier COVID-19 forecasting institutions, and expect their researchers to provide us with a forecast with Vermont-specific data sometime early next week. We believe their model will follow our other forecasts and confirm the good progress we have seen across our state. We were also heartened to see that IHME included Vermont in a small grouping of states that are best positioned to reopening at the appropriate time. Also, for those interested in learning more about any of these forecasts and our modeling partners, their assumptions, their methodology, their underlying forecasts, I encourage you to visit our department's COVID-19 webpage, which as of yesterday includes all of that information, as well as any of their interactive models as well. I want to again thank all Vermonters for their continued compliance with state guidance. You are making a major impact, and everyone should be very proud. However, as the governor emphasized, we cannot let this incredible work that we've all made pass in vain. We must continue to stay on this important social distancing track for the benefit of our neighbors, but particularly for the benefit of those who are most at risk. I know if we do this, we will emerge from this crisis even stronger and even more resilient. Thank you very much, and at this time, I'd like to introduce Dr. Levine.
Thank you. I don't need to reiterate the data presentation today, and I don't want to detract from the important messages that came from Commissioner Pichak and the Governor, so I'm going to limit my remarks today to one public health message, and it's an important one. As a byproduct of the COVID era that we're in now, healthcare institutions across the nation are reporting marked decreases in patients presenting with heart attacks, strokes, and other serious medical illnesses. One could try to come up with a scientific theory about why that is, and indeed, research is underway. However, the prevailing thought is that the diseases have not gone away, but people are reluctant to present to hospitals and other healthcare institutions, worried that they might contract COVID. A very understandable concern, you might recognize, but at the same time, my message today is our institutions are safe, especially here across Vermont. Should you have symptoms that make you think you have COVID, call your healthcare professional. But should you have symptoms that you think might be more serious, such as an impending heart attack, a possibility of a stroke, or any other serious condition that you would have normally sought medical care for, please make sure you seek medical care, whether that be with a phone call, whether that be with a 911 call, or a presentation to an emergency room. Thank you.
At this point in time, we'll open up for questions.
All right, we're going to start in the room with Stuart.
Dr. Levine, are you saying that you'd be worse off reacting to the fear of COVID than, I mean, put it plainly, if you would, you're at greater risk by staying home if you feel you're having a heart problem than you would be going to a hospital. Is that?
Absolutely. I really do believe that. Our healthcare workers go to their site of employment every day. They are heroes, truly, as they are being called commonly across the country, because of the fact that they may be exposed to other patients with COVID. But clearly, if they were uncomfortable with the environment they were going to, they would not show up. And the fact is, one can go to that environment with a non-COVID complaint and feel comfortable that everyone being on such a high covert alert status themselves will treat them in the way that they would want to be treated so that they can have their condition attended to and not come out of there with an infection as a byproduct of that visit.
Can you, I mean, are you separating COVID patients from others such that people can expect they would not be exposed when they walk into the emergency room door?
Oh, absolutely. Yeah. I mean, there's a protocol for every person who's going to present to an emergency room. And I think the staff are well aware of how to make sure that the right things happen for the right person. And of course, our EMS responders are also on very high alert regarding COVID as well. So again, their environment that you would enter on your way to the hospital, if it was that serious, would also be protective for you, just as it would be protective from them if you actually had COVID yourself.
Calvin?
Thank you. Message or question for maybe the governor or Commissioner Harrington. So in the first turn of the spigot this past week, we know how many Vermonters went back to work. So I'm just wondering if it's possible to be able to do, I guess, forward contact tracing, right? In terms of, maybe people sign in to work, and so we know how many people are actually getting back to work.
Yeah, I think it's a bit early to retrieve that information because it's, as we gave the order, it's two people at a time starting on Monday. Maybe some didn't go to work immediately, and to collect all the data is going to be difficult in this short time period. But But over time, again, from our standpoint, it's important to have that and know how many people are going back to work and how many people are coming off, let's say, unemployment. But at the same time, just watching the trajectory and watching the modeling to be sure that the number of COVID cases, positives, aren't rising at a dramatic rate. And they may rise a little bit as we open up more businesses, but we don't exceed the limits of our healthcare system. So that's what we'll be watching. Maybe Commissioner Harrington, do you have any thoughts on this either?
I'll just add, Governor, that we'll be watching. We'd really be looking for trending data in terms of number of weekly claims filed. So, like you said, at this point, it's just too early. But as we see the trend line going forward, we'll be able to report back.
And as a follow-up, do we know what percentage of the workforce, I guess, shut down when we had all of these mass closures?
I don't know. I mean, we know obviously how many have signed up for unemployment, and through the pandemic unemployment assistance with self-employed and independents, that's starting to trend a bit, and we're gathering those numbers. So we know the magnitude of the tens of thousands. And Commissioner Harrington, do you have a figure on how many at this point in time are on unemployment or assistance at this point?
Yeah, so we know that our workforce is somewhere between 330,000 to 350,000 under normal circumstances. We know also that we've received roughly 80 to 85 initial claims. That's prior to PUA, but not all of those are eligible, of course. So I think we're roughly at about somewhere between 20 to 23% unemployment. But again, that's a very fluid number as we see numbers, weekly filings go up and down each week.
All right, we're going to go to the phone lines now. The first up on the phone is Chris Roy, Newport Daily Express.
Yes, good morning. I'm just wondering if the governor can give an update or somebody can give an update looking towards Memorial Day weekend. I've heard from several people over this past week who are concerned about planning for large Memorial Day events. In one case, there will probably be about 300 or 400 people in an event. Should they continue planning for that event? And
Yeah.
I'm also wondering when the state can expect to open up the personal care services industry, whether it's beauty salons or hairdressers or something along those lines. And can you kind of give an update when that's going to happen? Thanks.
Yeah, again, very difficult to determine at this point in time. As I said, we're watching the data, watching the trending, making sure that the numbers aren't growing. So as we open the spigot one little turn at a time, we don't do anything that would have a detrimental effect on Vermonters. So to determine something out that far, Memorial Day is going to be, again, very difficult to do. I know that there are some parades in Memorial Day parades who have already canceled. So I would expect we'll see more of that as time moves on. But again, I can't stress enough this moderate approach, methodical approach is something that we're just going to have to take week to week. And for me to promise or to take something away from someone who is counting on this a month or month and a half away, I don't think would be beneficial either. So again, you'll just have to bear with us. We'll do the best we can in trying to open up this economy and get people back to whatever normal is in the future as quick as possible. But I wouldn't be able to give you any dates at this point or any certainty.
Okay, thank you. What about the personal care services? Any indication when they might be able to reopen?
Again, we look at risk there as well. When I see I was reading a John Hopkins report, Guidance to Governors, and they give a rating as to what is high risk or high densities and so forth. And so we take some of that, and we have this team that is working on what we could open and benefit the most people with the least amount of risk. So I know our team is looking at this and is presenting on a weekly basis as to what they have for ideas. But I'm sure it'll come up at some point, but I'm not sure where it is on the list at this point.
Okay, thank you very much.
All right, Wilson, the AP.
Okay, I'm no longer muted. I have three questions, but I think the first one is really simple. A few minutes ago, one of you mentioned I think it's the IHME, is that the correct initials? Had some sort of a report or something or other that Vermont was among the best states to go forward. Is that something you could share with us? I would be interested in seeing that.
Yeah, Commissioner Pichek. We'll let just take one at a time, maybe. Commissioner Pichek?
Okay, sure. I mean, that's just send us a link or whatever question. I'd be interested in seeing that.
So Wilson, if you do go to our website, and I think it was provided in the media briefing, we do have information about IHME's interactive model, also their white paper. If you go into that website, you'll be able to find information updated as of last Friday, putting Vermont with 3 other states that are in the best position to reopen.
Okay, great. I will go look for that. Thank you. The second question is, why do you think, and this is for whoever wants to answer it, why do you think Vermont is doing so well? I mean, is it a function of being a small state, or is it just better management and cooperation from everybody?
I would have to say, and I'd ask Dr. Levine to weigh in as well, but from my standpoint, it's just the amount of cooperation we've had. It's about Vermonters and doing the right thing. And they don't always like what they hear, but I was pleasantly surprised when we had one of the initial closures was the bars and restaurants, and this was right before St. Patrick's Day. And I thought that there might be an uprising as a result, but again, I have to give Vermonters great credit and those owners of those businesses for closing down immediately and seeing the risks. And I think we care about each other enough to know. And we're a small state, rural in nature, but I think it's just how we're built. And I think when we're in trouble, we band together and try and do the right thing. So I think it's probably all the above. The strategies we've used along the way. Again, they've impacted a lot of people personally and financially, but at the same time, it appears that we made the right decisions. And we did this together, and it wouldn't, putting these measures forward they're only as successful as people who have a willingness to do it and follow direction in some respects. And again, I think Vermonters have come together in this time of need to do the right thing. Commissioner Levine?
Okay, perfect.
I can't add a lot to that because I don't want to minimize anything that was just said as being the key players in that role. The only additional things I'd say are we did follow the science and we followed the data that you've been looking at all along. And a lot of this is about timing of things. As we're fond of saying, it's not always the if, but it's the when. And the timing was very carefully calibrated for each of the interventions that came very sequentially over time. And in the end, comprised the suite, if you will, of mitigation interventions. And they all needed to be done to be successful, but they needed to be done in the way they were done and played out. And I think we did try to be as early as possible in this epidemic, which is an important point, not to let things get out of hand, but also not to come in with the most stringent policies at a time when they might not have been effective. Thank you.
Okay, and thank you. The third question is a simple one for Dr. Levine again. You were just talking about healthcare providers noticing people aren't seeking medical services. Are there any bad outcomes that you can point to? You know, somebody who did have chest pain didn't go to the doctor, and then things didn't turn out like they could have if they would have got prompt attention for it, you know, in any, not just heart attack, anything on there.
Yeah, so there's more national data than I can cite local data, and it's just statistical, just knowing the normal frequency of these events in a population and saying there can't be a silver lining to COVID that there's less of these events occurring because you've acquired the virus. It's probably because people aren't presenting as much. One to-do thing on the to-do list is to work with our medical examiner, because we so often recite to you the deaths that came as a result of COVID, but that's not the only thing people are dying from, and to see if there is anything unusual about rates that are being seen that would contribute to what you were implying, that maybe we are having bad outcomes that we're just not aware of. The other thing we'll learn quickly when the healthcare system gradually begins to open up again is if there are people who actually have done worse because they weren't attending to things until they felt more comfortable engaging with the healthcare system. Hopefully that won't be the case, because we have such a robust telemedicine, telehealth, and even telephone medicine operation going on now that I know Vermonters are accessing. So hopefully we won't find that they've let things go too long.
Okay, great, thank you.
Wilson, I just wanted to also add maybe a little caution to the wind, and something that I always have my eye on, and I've mentioned this before, but as we have all this good news here in Vermont, we're not an island, and we're doing all the right things, and we're seeing the benefit of doing that. But not very far from us in some of those other states. New York is past their peak, but they still had thousands of deaths last week. Massachusetts, Boston in particular, they had 1,000 deaths again last week. They're in their peak right now. That's 180 miles away from us from right here. As well, Rhode Island, Connecticut, New Jersey, still right in the middle of it. So that's why we have to do this methodically, cautiously, knowing that anything can happen, and we just have to make sure that we're as cautious as possible and protecting and watching the modeling to make sure that we don't exceed that healthcare capacity, because we might need it at some point. So I just, again, with all the good news, I just want to let people know what's on my mind as we move forward.
Okay, thank you very much, all of you.
Thanks, Wilson. Joe, Barton Chronicle.
Hello, I think this question is for Commissioner Picha. I was looking at the slide labeled positive trend active cases in Vermont, and I noticed that after 4/19/2020, the lines representing active cases and confirmed COVID cases diverge radically. I understand the active cases going down. I don't understand the red line going up. Is this just a question of more testing?
Yeah, so good question, Joe. So the active cases, as you point out, start to go down, and that's because the confirmed number of cases starts to slow down. So as we get less and less cases, new cases into Vermont, then obviously those cases that were active, 14 days prior, 10 days prior, those folks recover and get better. They're no longer actively shedding the virus or actively have the virus. But the additional new people that have the confirmed virus continues to shrink. So we see those numbers diverge as the confirmed cases do slowly go up. And again, this is a forecast, and we're doing better than that forecast. And then the active cases, again, start to drop off pretty quickly thereafter.
Thank you.
All right, Mike Donahue, the Islander.
Good morning. I'm not sure who this is for, but the governor noted at the start to keep the eyes on the data, and the Islander continues to get inquiries from readers, not only in the islands, but readers in Colchester, Milton, into Franklin County, they want to know about their individual towns and maybe their neighboring towns. Local. They want to know about the tests in their towns.
Yeah.
Countywide numbers maps can be misleading and meaningless. Franklin County shows 90 cases, but 3 dozen of those have moved to Caledonia, which claims 12. So who else has moved? And now that HIPAA's been disputed, is no longer a valid, is not a valid reason to withhold this. I'm just wondering when we're going to see these individuals. And as Dr. Levine shared these with the local health officers who are the health department network.
I think we have an answer for you. I'm going to let Secretary Smith answer this one.
Mike, I think this, Mike Smith, Secretary of Human Services, I think you brought this issue up about a week ago, and we've been working on a map that will list these confirmed positive cases by town. I think we'll be ready by Monday to display that list as we move forward. So you'll be able to see the data by town on Monday on a map that will be on the Health Department website.
No, I'm sure to tell you, a turkey. Hello? I don't know. There's some interference I didn't hear. But I'm just wondering, Dr. Levine, I'm just wondering if you have shared that with your individual local health officers, whether you shared them with the governor or the public safety commissioner. Who have you shared the individual towns with so that local officials know whether they've got a problem in their town?
Yeah, so the sharing comes with the actual data being completely authenticated, made accurate, etc. So it will all happen on Monday.
So the local health officers in your network there have not even been told if they've got a problem, like in the town of Swanton or Manchester or Wallingford or something, if they've got a huge percentage of the county number, they have not been told at this point.
True, although should they have whatever you call a huge problem, we would have already been in the loop with them on that.
Well, how many towns have you reached out to then that have a huge problem?
So most of the towns that we've reached out to have facilities in those towns where outbreaks have occurred. And so by virtue of having the facility and people working at that facility, they are aware of what's gone on. Throughout the rest of Vermont.
Can we get a list of the facilities? I know we've talked about Birchwood, Burlington Health and Rehab, the Correctional Center, but can we get a complete list of all those facilities?
Yes, and I believe we've shared a lot of that previously, but we can do that again.
I know we've got a lot of them. I just want to make sure we're not missing any.
Sure.
All right.
Great. Thank you very much. Appreciate it.
Brittany, Local 22.
Hi. So kind of a two-part question here. I'm wondering about the status of the unemployment log. I mean, we've got a lot of calls from our viewers saying that they still can't get through and they're not getting the payment protection program. Either it's not taking applicants or it's not ready and they're not getting their benefits. So I was just wondering about that. Is it backed up and everything? And then I guess the second part of my question is just about, we also had a viewer ask about being, self-employed, and that they filed for unemployment a week ago. And then now they're trying to file to be self-employed, but they're told that they're not allowed to because they're already in the system and they're having issues with that. And just curious as to, what they should do.
I'm going to turn this one over to Commissioner Harrington.
Sure. We continue to work through any backlogs we have, but most of the general UI claims have been paid, except for those that are going through the adjudication process. We continue to add people to that team to expedite adjudications to the best of our ability. We did open up the Pandemic Unemployment Assistance Program, not to be confused with the Paycheck Protection Program, but the PUA program is for individuals who are either independent contractors or self-employed individuals or others who are not generally eligible. The first group that we've allowed to go into the PUA program are the self-employed and independent contractors. There are pockets of that group. This has been an ever-changing situation over the past 6 weeks, including just improvements to our system. And so we are hearing nuanced situations where people try to have gone through the initial application program, but then when they try to go into the PUA program, for some reason the program is not allowing them in or doesn't recognize them or their information. We've been managing those and clearing those as soon as they come up. But we are getting some cases where that information didn't transfer over for one reason or another between our mainframe system and the PUA program. But most people, in terms of general population who are self-employed or independent contractors, can go in and complete the application from start to finish. They fill out a new claims application or initial claims application, and as they go through the initial claims application, if they begin to identify a self-employed or independent contractor, that application becomes expanded to include the PUA application as well. So they end up filling out both components of the application, and then they'll receive contact in 12 to 24 hours. Just letting them know that they are eligible for PUA and can move forward with weekly filings. There is a population out there that we are working through right now, which are people who don't necessarily fall into the self-employed population, but also are not typically eligible under general UI. We are aware of that population. That is where some of the people are getting hung up. And we're working to bring that population into the PUA application. An example of somebody who might fall into that group would be if they had only been working for their employer for a month or two prior to being laid off. They may not have enough wages in the UI system to be eligible. They would eventually become eligible under PUA, and we are moving those people into the PUA system today and over the coming days. So those more and more people will become eligible as they're brought over into the PUA system. Did that answer all those questions?
That does. I just have one follow-up. So our viewer also said that they were told to fill out a PUA application and that it would be sent to their email. Also check their spam folder that might be in there, but they said they never received it, and that it had been a couple days, and they tried to call, but the DOL is not accepting phone calls. So I was wondering about that as well, if you've heard any issues with this.
Sure. Again, there are a couple things that happen there. One is if they submitted the PUA application, it will take 12 to 24 hours to process in the system. The system has only been up for 36 hours, so again, it may be that it just hasn't been processed yet, and that's why they haven't received the email, or there was an issue on the claim that needs to be adjudicated. There aren't many of those, but there are a handful of the people who have applied. Just so people are aware, as of about 10 o'clock this morning, we had about 5,800 PUA applications been submitted, and I believe about 19,000 weekly filings that have been submitted because people are able to go in and file for back to March 15th. In terms of the phone calls, certainly we knew there would be an influx as soon as this program went live. We have our Maximus vendor, which currently has 30 people on as of yesterday. They will be adding another 25 people by this afternoon. And then as of Monday, we should have somewhere between 70 and 80 people in that call center alone, and they're the ones handling the PUA. We'll continue to track data and call volumes over both yesterday, today. The call center is open on Saturday, and if we need to make additional adjustments, either in more staff or shedding other calls that are going into that call center to a different group of people, we'll be making those adjustments as soon as that information is available.
Thank you so much.
Yes, ma'am.
Patricia, Bennington Manor.
Hello, can you hear me?
We can.
Hi. I just have a very quick question for Commissioner Harrington, and you may have mentioned it and I might have missed it. When did the Pandemic Unemployment Assistance Program officially go live, that is, accept applications? And was it accepting both online and phone applications immediately, or did one start first and then the other?
Commissioner Harrington.
So yes, sir. It's completely electronic. We do have a call center up that will help people answer questions. Unless someone doesn't have internet or doesn't have a computer, we will help people complete applications electronically in those circumstances. But people are encouraged to go online to our website to complete the form electronically under their own power. And if they have questions, they can call the hotline. I do know that there are some people who have not been able to get through on the hotline. That is something we hope to rectify by bringing on these additional agents this afternoon and then building up to Monday as well. And then with regards to the question of when it went live, it was over the evening of Wednesday. So I believe the first round of people received an email Wednesday evening. So again, we're kind of in the first 36 to 48 hour period of the program really being promoted. Fully live happened yesterday.
And you said that you had, I believe it was 5,800 applications as of 10 o'clock this morning for PUA?
Yeah, so we had approximately 25 to 3,000 applications by the end of the day yesterday, and as of 10 o'clock this morning, we were up to 5,800, and certainly as we bring in more eligible groups, but also as more and more people become aware of the application, we'll see that number grow. What I will just say for the record, so everybody can share this out there, if an individual has not completed any application yet for the Department of Labor, on the department's homepage, there is a link that says complete an initial application. That's where they should start. If they click self-employed, it will automatically add questions to the application to allow them to also apply both for general UI and PUA all at one time. And that is the quickest way to get into the system. What we are running into, or the people who are running into problems, are people who may have already filled out an application prior to PUA going live. In those cases, if they indicated they were self-employed in their initial application, there is a link for them to go into the PUA application and complete the application. But again, there's this other population of people who are not self-employed, not independent contractors, but are not eligible for general UI. And it's likely they will be eligible for PUA, and we're working through that process right now.
All right,
but again, yep, go ahead.
If I understand you correctly, I'm just a little confused at what you mean. So the people who want to seek PUA should file an initial claim with general unemployment, or they should file an initial claim with PUA, or are those terms one and the same?
So the part where it becomes confusing and not of our doing, but the federal requirements are explicit in that someone must first be denied for general UI before they can be eligible for PUA. What we've done is try to streamline that process. So instead of someone submitting a general UI application, waiting for a determination, and then applying for pandemic unemployment assistance, it's all part of one application. So all they need to do is complete an initial claims application, which will allow them to fill out both the general UI questions and the pandemic unemployment assistance questions, depending on what they select within the application. The only people that would need to simply fill out the PUA portion of the application are those that had already filled out a general UI application prior to Wednesday. And again, that was, I know it gets confusing there. There's really no good solution, but we're trying to make it as seamless as possible. So if they haven't done anything as of today, they simply need to fill out an initial claim application, and that will include, if they are eligible for PUA, to have them fill out the PUA question.
So if they identify, if they make an indication on the form somehow that they would be eligible, like if they were self-employed, if they say they were freelance, things like that.
Correct.
All right, Patricia, if you have any follow-ups, maybe you can connect with the Department of Labor afterwards directly as well.
I'm good, thank you.
And Wallace Allen, BT Digger.
Hi, my question is about the order that allows 5 people to go back to a workplace. Governor, is there any guidance you can give people who I know will be asking, what does that mean for my my company that has a lot of different departments where people don't come in contact with each other? Can each have 5? Questions like that you've probably already heard.
Yeah.
Can you just give a little more detail?
Yeah, I'm going to ask Secretary Curley to give that explanation because I believe it's in the guidance.
Yes, thank you, Governor. Secretary Curley here. If somebody is unclear from the executive order and would like additional guidance, we have additional guidance on our website at accd.vermont.gov. And folks can go there, get additional guidance. If they're still not sure, there's a place to select a tab to seek additional guidance, and we can get detailed information about how they operate and try to walk them through it and get to the right place.
Can you just tell me for the example that I just gave you how that would work? Like if a company has say 40 units, that only 5 can go back, or if they're never coming back with each other, could there be more?
I'm not comfortable not knowing what the setup of their arrangement is, so I'd prefer to understand specifically what the setup is. There are guidelines in our guidance that talk about spacing, so I would suggest that they go there first, but we're happy to try to get those answers for them. It would be uncomfortable giving a blanket answer in this situation.
All right, thanks very much.
Thank you.
Do it for me.
Kat, WCAX.
Hi, my question today is about antibody testing. California has already ramped it up, and early data that was described yesterday by Governor Andrew Cuomo in New York from their serology tests have shown that up to 1 in 5 people in their city area could have the antibodies to this virus. New York's health commissioner has said he's confident that the tests they're using are accurate enough to use to determine immunity and maybe even send people back to work. I've been fielding several inquiries from Vermonters who want to see if they may have some immunity to COVID-19. They're hearing about these testing programs in other states, and they're wondering why Vermont isn't rolling them out faster. So my question is, when can we see antibody testing among the general population here, and why isn't it more of a priority right now?
Sure. Don't conflate the fact that it isn't happening with it isn't a priority, first of all. We had an expert working group report back to us, I believe, just a week ago, and they were not comfortable with the state of the testing at that point in time with regards to its accuracy and validity, and would it give us the information we were looking for comprehensively. So we elected not to go with it at that point in time. One of their specific recommendations was to not use it for individual use, such as, can I go back to work tomorrow? But that population level, what we call seroprevalence studies, would be appropriate when they could recommend a specific testing panel. So we are going to be doing it on a more population-based basis, as you implied with New York, and it will be in the near future, I can tell you that. It won't be tomorrow.
So I guess the follow-up then is, when is our next set of recommendations from that working group due? You said, I know last time that they had a month to reevaluate antibody testing. Is
Right.
it still going to be a month from now? Did we hear anything else
Right.
about it?
So now we're probably 3 weeks from now. I will say that my laboratory team and epidemiology team and myself were on the call last night, Just Vermont, with the White House Coronavirus Task Force, and we actually asked them many of the same questions you just asked me, and they did not actually have answers to them all at that point in time, and said they would be getting back to us to also help advise us. So we're not just looking to our local expert group, if you will, but we were looking nationally as well.
Are we working with New York at all, given that they're, spearheading this among their citizens?
We're not working with New York for this particular problem, no. No, I can tell you that there's lots of conversations going on with New York all the time, but not on launching this prevalence study.
I guess the question, I'm going to pull this directly from an email I got from a viewer who's wanting to know if the tests are good enough for New York, why they're not good enough for us.
You'll have to ask New York. I've told you the guidance we've received, which confirms some of the guidance that I've been hearing from many other places and that my reading has led to as well. But I can't speak for why New York thinks they're good enough at this point in time.
All right, thank you.
Sean Cunningham, Chester Telegraph.
Thank you. This is a two-part question for Secretary French. The federal government is sending a little more than $31 million in emergency relief funds for the AOE to hand out to Vermont's elementary and secondary schools. First, how will those that money be apportioned to the various school districts? And second, is the AOE is allowed to keep 10%, with about $3.1 million of the money for administering the funds. But will the AOE be keeping the money or passing it on to help the schools with their budgets?
Hi, good morning. This is Dan French. Thank you for the questions. The first question was, how is the AOE going to be allocating those funds out to school districts? Firstly, I'll point out the application just went live yesterday after 2 o'clock in the afternoon, so we're still formulating that guidance, but my understanding is that we'll be allocating those funds to the school districts based on the same formula that Title I funds are allocated, which means it's a function of their, basically the census information and poverty levels. Second question pertain to the agency's ability to reserve up to 10%, approximately $3 million. Yes, we haven't decided how much we're going to reserve at this point, but we are anticipating reserving some of that to identify the needs at the state level. In particular, our expectation is that there are going to be increased needs for social and emotional support for students. So we're thinking that both of our reservation would be targeted to support the social and emotional needs of students as those emerge through systems statewide.
Thank you.
All right, Tim McQuiston, Vermont Business Magazine.
Good morning, Dr. Levine. I have seen reports and actually talked to a doctor about the changing use of ventilators. They've been not as successful, I suppose, as hoped, and there's a new procedure of actually turning patients on their stomach while they're on oxygen and not intubating. And I'm wondering if that practice is being done here in Vermont, and if you're finding any success with that.
Right, so you're referring to what's called prone positioning, and let's go back before the COVID epidemic. That's actually been a part of care and ICU management for a select group of patients anyways. So even without saying what the cause of their respiratory difficulty was, it was often being utilized as part of ICU management. I don't want to go too much further than that because I'm not actively managing patients right now in the ICU, and I can't speak to exactly how that protocol is being implemented in the COVID era. and if there's been any differences or not. I can say that one thing we're learning about this infection is that people, even early in their course, sometimes knowing it themselves in terms of the way they feel, other times unbeknownst to them, can drop their oxygen levels quite a bit if you do oximetry studies on them. So I think we're learning that perhaps understanding how well someone's oxygenation is going early on can be useful in hopefully providing what's needed early in the course and maybe preventing the need for ventilator management later on. But it's all in the sort of formative stages right now, so it's hard to say much more about that, but we're gaining a greater appreciation of that in people who thought they were doing better than they might have by how the numbers look, so to speak.
As a follow-up to that, in your earlier discussion about patients perhaps being reluctant to go to the hospital, UVMMC had a release yesterday about there hasn't been a positive case among staff in a couple of weeks, I guess. Is that typical of all the hospitals in the state, that the staff are not showing any positive cases?
You know, I don't have data in front of me on that, so I'd be reluctant to generalize in that way. Certainly, we're not hearing about huge healthcare workforce issues, and that was one of the things as we were planning for surge we were really concerned about. We always talk about hospital beds and ICUs and ventilators, but the healthcare workforce was an equal part of that concern. And we had the Medical Reserve Corps, and we had concerns about would we need to pull people from other places, and that did not come to be. So my hope is that we're not seeing inordinately large numbers of healthcare workers unable to come to work because of COVID. But I am aware there have been infections in healthcare workers. That would be completely true. I just don't want to generalize to saying it was a minimal problem everywhere across the strait without having data for you. But we'll try to find that.
Thank you. All right, great, thanks.
Avery, WCAX.
Hello. Do you all plan to release more strict guidelines on facial coverings, potentially making them mandatory? And what can you say to the availability of these type of coverings? I know there's been, with stores closed and things, I know people have kind of been having a hard time trying to figure out what should they be using to cover their face if they don't have the typical actual mask cloth covering.
I'll answer part of that, then I'll turn it over to Dr. Levine. But as you can see in the guidance, and as we had portrayed last week in the guidance, that anyone in all employees that are going back to work must wear facial coverings, or if they're in a retail situation and they're cashiers, they can utilize Lexan if they've already set it up, a sneeze guard of sorts. But all other employees must be wearing facial coverings. And so we reiterated that in this week's order as well, to make sure that that was perfectly clear. Dr. Levine?
And I would just urge, if people have not done it, to go to healthvermont.gov, our COVID-19 website, which has extensive information on it about cloth facial coverings, links to descriptions about how one can make them their own, and also links to places where one can purchase them without, again, making any commentary about which place would be better or what have you, just an available list that we have so that any Vermonter can figure something out in terms of what to do for a cloth facial covering.
A quick follow-up. Has there been, who's enforcing people, employees specifically wearing masks? Is that something that's happening?
Yeah. You know, that was an important part of this week's order. And when we wanted to increase the number of people going back to work from 3 to 5, or 2 to 5, we also put in place a guidance to make sure that they were getting the proper education as well before they go into the workplace. So we have tasked the employers with dedicating a health and safety officer on these job sites, and as we increase the numbers moving forward, they'll be properly trained by VOSHA, as well as independent associations and so forth, who already have programs in place and have been approved or will be approved by VOSHA. So this is on the employer, their health and safety officer in particular, that will have to make sure that all of the guidelines are being followed. It's not just the facial coverings, but also sanitize different areas and other guidelines you'll see in the order as well as in the guidance. So we want to make sure that the work sites are safe and that all the protections are put into place and that the employees have the training necessary to understand why this is really important, because in the future they'll become a resource for us because they'll be properly trained and can train others, their families and so forth, on why this is so essential. So in terms of where you can have masks made, again, I had when I saw some of your reports on the National Guard setting up a facility in Essex, and I didn't see many of them having facial coverings. I engaged the Vermont Glove Company in Randolph, and they made 100 of them up for me to bring to the National Guard members. So there are many Vermont companies who are making these, and I know a lot of people have donated their services in this regard, and many have made their own. My wife made a few dozen as well. So it can be done. You just have to search it out, but there are a lot of companies making these facial coverings right here in the state.
Thank you.
Alex, Journal Opinion.
Yes, thank you. This question is related to Commissioner Piechek's active cases slide, and I'm wondering, are asymptomatic carriers factored into those numbers?
Yeah, so what we have modeled on the presentation is confirmed cases, but of course there are asymptomatic patients as well. Of course, what the percentage that is asymptomatic, we talked to our experts about that. The estimate could be 25%, it could be less, could be more. There's not great scientific definitiveness on that point, but you can assume that though when the number of confirmed cases slow down, so do the number of asymptomatic cases. So it is factored in that sense, but what we've depicted in the chart is just confirmed cases.
Okay, just a quick follow-up. So you're still using the 1 in 4 or 25% as sort of a rough estimate?
I think it's a fair rough estimate, but again, there's not a sort of scientific conclusion or definitiveness about what that number is at this point.
Great. Okay, thank you so much.
Yep.
Aaron Digger.
I have a question about out-of-state visitors. At the moment, the state has a 2-week quarantine in place for out-of-state visitors that could prove difficult to reconcile with summer tourism. As more people start coming up to their summer homes or visiting Vermont places with larger COVID outbreaks, what restrictions are you envisioning for tourists and visitors? Are you concerned about new visitors causing a new wave of infections?
Yeah, very concerned about people coming into our state. As I explained earlier, when we look just 180 miles away to Boston, for instance, they had 1,000 deaths last week, and their cases are continuing to climb, and they're right in the middle of this pandemic, and they're very, very much a hotspot. And New York is not out of this either. Thousands of deaths last week with Rhode Island and Connecticut and New Jersey as well, being right in the middle of it. So yes, I'm very concerned about what this means to Vermont, and that's why we have to be really careful and cautious about what we do and what we open up, and because that could be an attraction to some from other states to come to our state. But so that's why we've left this measure in place, where if you come into the state outside of Vermont, that you have to self-isolate for 14 days. Now, understanding as well that we have a lot of our Vermonters who have wintered in Florida or other places coming back to Vermont, we took this up, and I actually tasked our group, our working group, to find a way for us to streamline this in some way, whether it's going to be a test of some sort. I don't know, but it is on our list of areas of concern for me. Vermonters, again, that are just coming back home, and we want to make this as easy as possible. But until we have that guidance, they should consider either staying where they are for another period of time, or be prepared to self-isolate for 14 days once they get here.
Okay. As a follow-up, we're hearing from businesses that operate, tourism-related industries, summer camps, events that usually occur in the summer, that they don't know how to plan for what's going to happen this summer. Do you have any advice for them specifically?
Yeah, well, once again, we're taking this week to week. It is on our radar, and we know how important summer camps are to the vast number of Vermonters, as well as child care facilities. So it is on our list, something that we hope that we can have some guidance in the near future. But at this point in time, we don't have, while we're considering it, we don't have anything definitive to give you at this point. But suffice it to say, we know this is an area of an issue, that these summer camps have to know sooner rather than later, as well as parents who have been counting on this as well for some childcare for the summer. So we're working on it. We're going to see what we can come up with. But at this point in time, any mass gatherings over 10 are still limited. But as we open the spigot a little bit more, hopefully we'll come to some conclusions.
As a follow-up to the conversation about masks earlier, are there any changes to issuing a mask recommendation for people in public places rather than a mask order for customers in stores and things like that?
Well, we have given guidance that we would hope that people that are going into public places would wear a mask. We hope that employers, obviously employees, are going to be required. But we are not requiring people, mandating that people wear masks when they are in certain situations. But again, some of the stores, we're hoping they can provide signage and guidance and education as to why this is important.
Okay, thank you.
Dan, Burlington Free Press.
Hi, I have a question for Governor Scott. Governor, we got a lot of good news today, including on PPE, but Vermont nurses continue to say that there's an urgent need to increase the supply. They've sent you a letter directly with a whole series of requests on expanding funding and having businesses turn over PPE. So there seems to be a disconnect here that I don't understand, and I'm wondering what you can tell me, about that, because the nurses really seem to be looking at this very differently.
Yeah, I'm going to let Secretary Smith answer that, or try to answer that. Obviously, I'm wondering about the disconnect as well. My wife is a nurse, and so I completely understand some of their fears. But Secretary Smith?
Dan, Mike Smith, thank you for the question. I often say I have two health commissioners, one that the governor has appointed and reports to me as the Secretary of Agency of Human Services, and the other one that I live with, who's a nurse as well. But to get to your question, I met with the CEOs. We do have a sufficient supply at the state level of PPE. And there is a disconnect here, and I've asked the CEOs of all hospitals about a week ago to start trying to communicate to their employees on the use of their PPE and how they're deploying their PPE, because we have had, as you can see in the slides, we've had or it's on the website, we've had a sufficient amount of PPE. Now, as we go forward, we're going to have to be careful with PPE as we start opening up different avenues as well. But there is a disconnect, and we're trying to get to the bottom of the disconnect of why we have the sufficient levels and still getting these requests for more PPE. So stay tuned for more, Dan.
Okay, thank you.
All right, Peter Hirschfeld, BPR. Pete, BPR.
I apologize. Governor, in anticipation of likely revenue shortfalls for the current fiscal year, have you issued any holds on spending for any departments and agencies for money that's already been appropriated for this current budget year?
Yeah, again, we put a number of measures into place. Secretary Young is on the phone, I believe, at this point, and she can explain further. But yeah, this is going to be an issue as we move forward. We are going to have tremendous opportunities, tremendous holes in our budget, as well as on the state side, local side, and all throughout state government. So we're going to have to make some tough decisions in the coming months. But Secretary Young, do you have anything further you could offer?
Thank you, Governor, and thank you, Peter. Yes, you've got it correct that we have been looking at our end of year, fiscal year budget. We have put a directive out to agencies and departments to minimize any discretionary expenditures they have for the next 3 months or the next 2.5 months now, or nearly 2 months. A hiring freeze for other than non-essential or critical employees, which are going through the Secretary's office. And more importantly, we've put out requests for submissions for a supplemental budget adjustment to be taken up by the legislature in May, and we are collecting those submissions this week and formulating a proposal for another budget adjustment.
Thank you.
Dana, Caledonia Record.
Good afternoon. This is for Secretary Smith. It was reported yesterday that the inmates within the search facility here in St. Johnsbury are not showing any symptoms of the virus and are currently undergoing testing to see if, in fact, the infection still exists. This was said to have is going to happen within the next 2 days. So the question is, if negative, how soon will the inmates be returning to the Northwest Complex, and will the transfer happen piecemeal if some of the 33 are still found to be infected?
Thank you for the question. There's a complex dance that's going to have to happen here. First, those inmates at St. Johnsbury are going to have 2 negative tests before they're eligible to be moved. Secondly, we want to make sure that Northwest has been tested as well for the second time, or retested for the second time, as we move forward. So we're gonna test the individuals at St. Johnsbury to make sure A, they get their 2 negative tests that happen, and then B, we're going to make sure that the facility in St. Albans is retested, and then we'll start making moves based upon those test results in the near future. I think the St. Albans facility is slated for retest starting this weekend or beginning of next week.
Okay. Is that the same time frame for the second test to come through in St. Johnsbury?
Yeah, I think we're doing the second test either today or tomorrow or over the weekend, but it's relatively in short order here. It's sort of in conjunction with the time frame that we're doing Northwest Vermont.
Okay, and thank you, sir. Just one follow-up. As there haven't been any additional inmates come to the St. Johnsbury facility beyond the 33, almost about 2 weeks ago. Is there a sense that, is there a plan, I guess, on the books that says when are we going to be able to not call St. Johnsbury a surge facility anymore? Or is it too early to tell for something like that?
I think it's too early to tell for something like that. We always want to maintain surge capacity depending on what is happening on the ground. Certainly, Northwest was as we tested in Northwest, we had that surge capacity in St. Johnsbury. We have the policy, as you know, that if one case is positive in an institution like a correctional facility, a long-term care facility, we will do universal testing in that facility. So it's just too early to tell what's going to happen here in the next month, I would say, or so.
Okay. Great. Thank you very much.
Just so I'm clear on what our intentions are, our goal is to bring those who have been sent to St. Johnsbury that are COVID positive back to that facility where they came from. So just as quick as we can, we want to get them back to the Northwest Correctional Facility.
Colin, 7 days.
Hi, I have two spigot-related questions for the governor. First, should we just be expecting announcements like this every Friday moving forward? Are you planning to make weekly announcements, or could you just tell us your timeline on that?
Yeah, that's basically my hope, Colin, that we can do this every Friday, work throughout the week, watch the modeling, watch the trajectory, watch other states, trying to determine what they're doing as well, so that we can work together in some capacity. And try and catch up to where they are, quite frankly, because we've been very restrictive and have benefited from that. So that's the plan. Hopefully we can continue to have good, positive news, and we'll be able to, again, open this in a methodical way so we can put people back to work.
Yeah, and then just to follow up on that, when you mentioned other states, I mean, how much is that going to weigh into your decision-making, the experience that other states are having in curbing the spread of the virus? I think you mentioned being aware that opening up too fast here might encourage people from other states to flock to Vermont. So can you just talk a little bit about your thinking there?
Yeah, in terms of some of the attractions in Vermont, whether it's our campgrounds or state parks and so forth, if we... in the case of, I know New Hampshire and Maine are very concerned about their beaches, for instance, and so not that that's a concern for us, but that's why they want to work together as a region with Massachusetts to make sure that they're open, all of them at the same time, so that one state isn't impacted. Now, Massachusetts isn't anywhere near ready to do anything like that at this point, but I know they're under an incredible amount of pressure to do so. Same holds true for let's say, golf courses. I know a lot of pressure is being put on those in Massachusetts and New Hampshire and Maine, as well as in Vermont. But if one does it and the others do not, it just puts a lot of burden on that one state and could impact them in an adverse way if we're to open up and a lot of people from Connecticut and New Hampshire and Massachusetts and so forth come to our state to play golf. So that's why we're trying to coordinate in some senses, and we'll continue to, I have almost daily talks with other governors in some state across the country, but certainly here regionally, we're staying in touch to at least be aware of what they're doing. Some of what's happened in New York, for instance, I wasn't aware until I heard it from the media. So we're coordinating more with New Hampshire, Maine, Mass, and so forth.
Thanks.
All right, that's all of our questioners today. Thank you, everyone.
Thank you very much. We'll see you on Monday. Thanks for tuning in.